I'm Mark Sirois, a physical therapist with Advanced Physical Therapy in Southgate, Michigan. Advanced Physical Therapy has 9 locations throughout Metro Detroit to serve you. To find out more information about our clinics and services, you can look us up at advphysicaltherapy.com. That's advphysicaltherapy.com. Today I'm going to talk about IT band problems, specifically IT band problems with runners. We have Mary here, who is a runner who has had some issues with her IT band over the last couple of seasons. Our treatment approach is comprehensive and is based on our comprehensive musculoskeletal evaluation, which will include the use of a selective functional movement assessment, which we use to identify, as I term, causative biomechanics. What is the cause for Mary's problem? We know she has IT band problems, but we want to find out specifically what are the restrictions or movement dysfunctions that she has that are leading her IT band not to tolerate her running. We utilize the selective functional movement assessment. We utilize Graston instruments, which are stainless steel instruments that help to identify soft tissue restrictions and to treat the soft tissue restrictions. My approach today is going to be a generic approach that we find useful in many IT band problems, but realize when you come into the clinic, our treatment is based on our evaluation findings. So it's specific towards the patient. I'm going to have Mary lie on her side up here. And we're going to demonstrate what Graston is and what it does. Graston, again, is the use of the stainless steel instruments which help us to identify or diagnose areas of restriction through the soft tissues. We use a specialized lubricant that lets the instruments glide over the skin. As these instruments glide over the skin, there will be some bumpiness or grittiness through the tissues which indicate areas of tissue, soft tissue restrictions. I'm limiting our treatment right now to Mary's IT band, but it could go all the way up to the hip. It could go into her quadriceps or her hamstrings. As these instruments glide through the tissues, we notice some reddening right away. I utilize the instruments first to diagnose or assess, which is what we call scanning of the tissues. And the reddening that's occurring through Mary's IT band right now is giving me some clues as to areas that are tight and restricted and need treatment. So we scan first, and then we'll come in with the same instruments, and we'll do sweeps. We might swivel through the area to help break up and free up some of the tight restricted tissues. We'll get in there a little more specific. The convex treatment head is a little more aggressive for treatment. And we'll get in there and work through the tissues. Typical treatment is approximately 1 to 2 minutes per restricted area. We'll treat with Graston every other day, typically 2 times a week, possibly 3 times a week, but never on consecutive days. We also follow that up with specific stretching. I'm going to have Mary move to the back of the treatment table. And after Graston, I may follow up with some pinning and stretching where I get my thumb right on the restricted areas and stretch that tissue down. And we'll go through a sequence of Graston, typically moist heat or ultrasound to the area to warm it up, or a physiological warm-up on a bike or elliptical. Take her through Graston to free up their tight restricted tissue. We do stretches then to help realign the tissue that we just freed up, and have Mary go through some dynamic exercises following that. Typically with IT band problems, I find that patients have a fair amount of weakness at the hip, typically runners. It will be very common for us to find some areas that we need to address strength-wise. We take the whole head-to-toe approach. It may include specific ankle stretches and ankle mobility exercises. We may utilize kinesio tape and send Mary home taped up before she goes for her run. We may utilize a cold laser, which is helpful in stimulating healing through this area. Additionally, cold packs and cryotherapy after exercise, ice massage can be very helpful. And as always, all of our patients are put on a comprehensive home exercise program. If you'd like more information about how advanced physical therapy treats runners, you can contact our clinic directly at 734-284-6582. Thank you.